Well, sadly, about 1 in 10 babies are born prematurely every year in the U.S., and babies who are born early are more likely to have health problems. That's according to the nonprofit organization March of Dimes.
November is Prematurity Awareness Month, and that's today's Health Watch. So joining us now is Dr. Beth Carew. She is an OBGYN at Premier Integrated. Beth, thank you for being here with us.
Thanks for having me.
I appreciate it. So first of all, what is preterm labor and premature birth? Kind of describe it.
So premature birth is babies that are born before 37 weeks, or when we've decided, term is where babies, have less health risks.
And doctor, what are the signs and symptoms of preterm labor here?
So early labor signs, contractions, regular rhythmic cramping of the uterus that's, in the pelvis, sometimes radiating to the back. It doesn't get better when you sit down or relax. Leakage of fluid, vaginal bleeding.
And, how do you know if you're at risk for preterm labor or premature birth? So talk about the medical factors, and are age and race something people should consider? There's a lot to consider.
There is a lot to consider. There are a lot of risks for preterm delivery. History is really important. So having had a preterm baby before, other medical problems such as diabetes or high blood pressure that might put you at risk, having pregnancy complications like multiple pregnancies or known anatomic changes to the uterus can put patients at risk for preterm delivery. And race is a really important risk factor. We know that Black women are at twice the risk of white women for preterm delivery, so really important to make sure that those are being addressed with providers, and that providers in the health system are doing our part to address those biases and do better.
Yeah, and you mentioned that briefly, but expand on it a little bit. But, are preterm labor and premature births preventable here?
Yeah, most cases are. Sometimes there's about a quarter of cases where preterm delivery happens because of a medical reason, and those, aren't able to be prevented as easily. But the remaining 3/4 of premature birth, especially if we can identify risk factors, there are certain things that can be done to help prevent them. And the most important thing to prevent preterm birth is getting regular prenatal care, talking about risk factors with your provider, looking at are there interventions that can happen, and just being educated on the signs and symptoms.
Yeah. And what's your advice for women who are visiting their doctors about kind of advocating and making sure they are having that candid conversation, right?
Yeah, asking questions.
Yeah.
Questions are the gateway to everything. Curiosity gets us everywhere. So, if you have questions about what should I be looking for, or I'm feeling this, what do I do next? I think that's always the best place to start. And then just letting your doctor know if you have any things that you're worried about put you at risk.
Yeah, being proactive in your health and your baby's health.
Yeah, absolutely.
Sure. Yeah. All right, doctor, thank you so much for joining us. We appreciate it. And you can watch this interview and all of our health interviews, of course, on our website, cbscolorado.com.